stroke victim could be anybody. And a stroke does not discriminate. A stroke doesn't care whether you're Hispanic, whether you're African American, whether you're Caucasian. It doesn't make any distinction.
Stroke is a very common disease. It's the fourth leading cause of death in the United States. In fact, there's over 690,000 strokes a year in this country.
A stroke is a lack of blood flow to an area of the brain. And as you know, the brain needs oxygen and glucose to survive. So when there is no supply of oxygen and glucose to the brain cells start to die.
There's a stroke that can happen because of the clotting of the blood vessels in which the brain suffers the lack of oxygen and nutrients and suffers an injury. That is called an ischemic stroke. There's a second form of stroke in which the blood vessels can either rupture directly, that is called a hemorrhagic stroke, or sometimes they form an aneurysm and then they rupture, that is called a subarachnoid hemorrhage. Baylor St. Luke's Medical Center is a comprehensive stroke center. Not only does it offer latest advances, it pushes the boundaries of advances and it creates newer treatments of care.
In the past 20 years, we've made a lot of stride in catheter-based technique, so now we call this endovascular. Endo means within the blood vessel. Now we take the more natural approach that we go through the natural pathway of the blood vessel and try to fix the problem from within the blood vessel.
We do have a treatment that is very efficacious. It's a treatment that could be given through an IV injection, intravenous injection, and it's called a TPA, which is a colbastin medication. If you receive that treatment within the first 4.5 hours after stroke onset, you are 40% more likely to fully recover 3 months later. Fortunately for all the patients that have access to the CHI St. Luke's health system, hospitals or emergency centers, they will be able to be evaluated and receive this type of treatment.
We as intensivists also take care of patients in the ICU. With the support of the excellent nursing staff, the physical therapists, the occupational therapists, we provide a wholesome care for our patients.
We do have also a telemedicine network, and it allows us to not only talk to the doctors and nurses in the outlying facilities, but also to patients and families. And we're able to communicate with them, and we're able to obtain the history from them. We're able to get consent from them about treatments, inform them about the risk and benefit ratios.
Our goal is not just to treat the patients, but also make sure that the families are kept in the loop as to what is going on with their loved ones, and at the same time provide them education and provide them assurance that the best can be done for their loved ones.
The best way to prevent stroke is to become knowledgeable about the risk factors. If everybody in this country knew about those risk factors, the incidence of stroke will probably go down by about 2/3 of what they are right now. Here at CHI St. Luke's Health System, we offer comprehensive care for our patients. We offer them a significant amount of information, not only about the risk factors and how to address them, but also how to live as a stroke survivor. We do have stroke support groups, and that's a very important component of the recovery and the treatment of patients. Stroke survivors come in and share their stories with other patients, and I think that's good, because that's a good way for them to not only see that perhaps they're not as badly off as they thought they were, but also to learn how to cope with difficulties and how to learn how to live with stroke. There is life, there is good life after stroke.
I think stroke is a disease that you cannot give up hope. You know, initially you can be very affected by it, but rehab, I think I've seen people make very, very good recovery from it. I always tell people, stroke recovery takes time. You cannot look at today and compare it to tomorrow. You gotta look at today compared to the next week, today compared to a month later, today compared to a year later. I always use the analogy, it's kind of like the baby's brain. It takes about 2 years to develop, and the recovery takes about the same.
If you feel you could be at risk for a stroke, click here to visit imaginebetterhealth.org and schedule a consultation today.